MCC has made such a huge impact in my life. It fueled the fire in me, and it's just for the first time I saw me again.
The MCC is really a safety net for HIV positive clients. We really try and take care of whatever their needs, whatever their gaps in care might be.
We try to get rid of any barriers to medical care that they might have. So that could be housing, financial issues, any legal issues, mental health, anything.
It's not just about HIV. There's other components that kind of make a person healthy. So I look at myself as a bridge between the patient and the doctor to be able to communicate effectively. So the message is being sent to the providers, and the provider is able to assist them the best way that they can.
Everything that we do for the patient here, not only at Men's Health Foundation, but in our program in general, is just assisting the patient with whatever they need. Sometimes they come through some challenges to get the care that they need, and that's where we come in.
I've been positive for quite a long time, and I was part of another system, and they treated me well for up until the pandemic, and then it eventually just got too difficult to make appointments. My doctor would never visit anymore.
I joined MCC like a day after I learned that I was HIV positive. So they were the first people to actually help me with that experience and on my journey to being undetectable.
I had been out of work since 2015 through a cancer diagnosis in 2012. I could tell you so many clinics and so many programs that I walked into. But in the middle of trying to find a job and trying to find help, I ended up coming across MCC.
I just recently dealt with bladder cancer, and it's been a bit traumatic. Ended last year. It was rough, but David Hoxie, who I've been speaking to, has guided me through this. Francis has been there for me. They've been there for me through all that I have gone through. They're reaching out to me, they're encouraging me, they're telling me how good I've done since I first started with them.
They communicate, they listen, and there's action. And you can talk to them. They'll call you and bug you before you call and bug them.
They've checked on me regularly. We've created an action plan. It's not just, tap on the shoulder. It's specific goals and specific tasks that have helped me get better.
I can count on my meds always be delivered. They call me and they're like, hey, want to deliver like tomorrow, the next day? Are you home? It's so easy.
The MCC started to help when I lost my car. They were able to send rides to places to pick up medication.
They've helped me through getting a lawyer for my disability, for Social Security. They've been there for rental assistance. They've been there for dentistry.
From STI testing to getting treatment, I just really was shocked and stunned and pleasantly surprised how quick the team was responding to all of the emergencies. The minute I shared my story, it's kind of like they all got to work right there and then. From setting me up with a bus pass, setting me up with health insurance, my medications. I think for the first time I was able to genuinely smile again, because I was able to think that maybe it wasn't like the end for me.
The most rewarding part is probably most likely the patients. It's always been the patient.
My motivation is just helping and serving the community. The community is what keeps me going.
Seeing people kind of thrive and overcome obstacles and ultimately be like the best version of themselves they can be.
We have patients that have come to us with feeling completely alone in the world, and we've given them the courage to navigate their healthcare journey unapologetically.
Just don't be ashamed to live your true life, your best life. Do as much as you want to do. Do it as crazy as you want to, as much as you want to. Just live your best life and don't be ashamed of what anybody else thinks about it.
HIV is not a death sentence. I'm living proof of it. I was diagnosed in 1992. I had pneumocystic pneumonia on the dance floor in London, sweating like a pig. I came back to the United States. My doctor said, you should be dead. I said, oh no, I have way too many things to do. And that's why I'm here now.
If the guy 5 years ago would see me now, he would be very proud of where I am today. I am so fearless and back to me because I know that I have MCC backing me up, and I know that if I trip and fall again, I know I can look up and David will be there.
They have been such a big part of my life. They have given me every instrument that I needed to be where I am today. If it wasn't for them, I wouldn't be alive.
Through all the years, it kind of like led me to wanting to be a good citizen, so to say, and to just be helpful, because that's what I'm receiving, so kind of have to give it back in the same way.
What I look forward to is kind of just HIV ending and finding a cure. But until then, I look forward to being taken care of until that happens.
People out there today who do need the help, who just need somebody to talk to, who need any kind of assistance for resources, top of the list is Men's Health Foundation.
You're in good hands. You're in very good hands from the beginning. When you call in the call center, that's your first point of contact. We'll take care of you.
You can always ask us questions. We're here anytime. If it's not for you, that's totally fine. If it is, then we're here to support in any way we can.
No matter how bad things seem like they are right now, there's people that can support you and have been there.
There's people out there that are genuinely out there to help you. Seek those people and make sure you have a good relationship with them. You can do anything you want to do with your life.